Hello, my name is Cody Longero. Welcome to my intervention presentation for a type 2 diabetes patient I have been working with and a reflection of my Capstone experience and experience in the Capella RN to BSN program. The intervention provides education on conditions associated with diabetes and what to do if you experience them. I then get into lifestyle modifications such as exercise and nutrition and explain how they can improve diabetes management. I demonstrate how technology enhances the quality of care and patient safety and why care coordination is vital to managing diabetes alongside the policies that shape the plan. The patient chosen as the subject of this assessment is Mr. VR. Mr. VR is a 46-year-old Native American who was diagnosed with type 2 diabetes when he was 35 years old. He's married with two boys who are 11 and 14 years old. Mr. VR lives in rural Nevada and faces significant struggles with finances. While speaking with him and his wife, they state that the disease process greatly strains their well-being. Mr. VR has been given information multiple times, but struggles to make all of his follow-up appointments. While he states he has been compliant with medication treatment, he still does not have adequate knowledge about how nutrition and exercise can help disease management. Mr. VR lives a sedentary lifestyle. While he says he would like to exercise, Mr. VR admits he has not been consistent with a routine. The intervention was focused on lifestyle changes Mr. VR said he was struggling with. In terms of mortality, morbidity, and costs to the healthcare system, diabetes mellitus is a serious health issue that affects a large portion of the global population. Globally, there were an estimated 415 million diabetics in 2015, and by 2040 would likely be 642 million cases of the disease. 90% of diabetics have type 2 diabetes mellitus, and this condition is becoming more common. The aging of the population and the rise in sedentary lifestyles that appear to go hand in hand with economic growth are two such variables. Importantly, approximately 80% of type 2 diabetes reside in low and middle income nations, Hurst et al. 2020. As a population, we are living more of a sedentary lifestyle than ever before. Type 2 diabetes is a disease that substantially strains the healthcare system and the patients and patient families living with the disease. Mr. VR and his wife were very receptive to the intervention. They said they appreciated that I considered their unique concerns in building the care plan. My goal was to provide leadership that served them. Transformational leadership is an excellent line of action in this circumstance, increasing followers' engagement in terms of motivation and ideals, as well as their understanding of current issues and the need for support, encouragement, educational opportunities is one of the most crucial roles of transformational leadership. Leaders must concentrate on enhancing their followers' ability to create original answers to challenges in order to perform assignments effectively. They must also provide them a vision of the future that motivates and encourages them as they cope with the difficulties of transition in order to help their followers align with the company aim. Transformational leaders ultimately affect changes in their followers' attitudes and fundamental beliefs. Saad, Alessa, 2021. Because of my intervention includes lifestyle changes that will be difficult, Mr. VR and his wife need to buy into the plan. The main goal for Mr. VR is to achieve better glycemic control. He's 5 feet 8 inches tall and weighs 225 pounds. Focusing on weight management is vital to his success. The intervention focused heavily on exercise and nutrition to meet this goal. Regular exercise helps reduce blood sugar levels, increases insulin sensitivity, and benefits both physical and mental health. Therefore, exercise is now regarded by all major scientific authorities as a necessary adjunct to medical treatment. Specific recommendations addressing frequency, duration, intensity, and modality have been developed in terms of exercise guidelines for people with diabetes. These recommendations include for performing physical activity at least 3 days per week without going more than 2 days per week without doing anything. Over 150 minutes per week of aerobic exercise should be done at a heart rate of 60 to 80% of one's maximum. Additionally, 2 to 3 times per week, but not on consecutive days, resistance training at an intensity of 50 to 80% of maximum should be performed, while practically daily flexibility and balance drill exercises should be done. Mr. VR was an athlete until his mid-20s, which was used to motivate him to help him get him back in shape. We decided to start on a recumbent bike for aerobic activity until he loses a little weight, as he currently experiences knee pain. Mr. VR struggled with portion management and how to plan meals. After much discussion, we decided on the plate technique. The plate technique is an easy, visible way to make sure you consume enough lean protein and non-starchy vegetables while reducing your intake of higher carb items, which have the biggest effects on your blood sugar. Start with placing non-starchy vegetables such as salad, green beans, broccoli, cauliflower, cabbage, and carrots on half a 9-inch dinner plate. Fill 1/4 of the plate with lean proteins such as chicken or fish, and the other quarter with carbs like grains, potatoes, or rice. Kwandana, 2019. Some feedback I received from Mr. VR and his wife is that it was a lot of information all at once. I knew it was crucial to provide evidence-based research to validate the plan. Reflecting on studies with proven success generated more patient buy-in. Summon Capella Library's online database was used to locate most of my references. I searched for terms pertinent to diabetes, lifestyle interventions, technology, and care coordination. I sought peer-reviewed studies that had been published in the past 5 years. I also consulted websites of recognized agencies such as the American Diabetes Association and the Centers for Disease and Control. Since studies have shown that telemedicine is beneficial at enhancing care, it has been suggested as a novel approach of providing care for patients with diabetes. Although telemedicine has frequently been touted as a cost-effective alternative, creating and implementing these systems comes with a price, including fees for people, equipment, and communication. Lee, 2018. Telemedicine was one of Mr. VR's preferences. He is tech-savvy and lives in rural Nevada. He has missed multiple appointments in the past. He was happy to hear we would focus on telemedicine appointments with our interprofessional care team. We also decided on the use of continuous glucose monitor. He's tired of poking his finger, and our physician and pharmacist felt that this was a good idea. Technology will play a large role in Mr. VR's new approach to diabetes management. The Nevada State Board of Nursing is in place to provide rules and regulations regarding what a nurse can do. The board's goal is to safeguard the public's health, safety, and welfare by enforcing nursing regulations that are effective. It is a government organization created by Nevada law to safeguard the public from harmful nursing practices. Board mission and purpose, no date. There are things I am unable to do as an RN. If Mr. VR needs a change in his medication, he needs the help of his doctor and pharmacist. This medium is why an interprofessional approach is essential to success. Access to healthcare has been facilitated for poor areas under the Affordable Care Act. Mr. VR claimed he is quite concerned about the cost of his medical care. Many people are unaware of the benefits for which they may qualify. The Affordable Care Act, which took effect in 2014 and made significant adjustments to Medicaid eligibility, subsidies, healthcare exchanges, increased consumer protections, and individual and company mandates, intended to totally overhaul the American healthcare system. Ye and Rodriguez, 2021. I ensured all recommendations in this plan were covered for Mr. VR. If he felt I was recommending things that would not cost him more money, he would be less likely to stick to the program. A healthcare organization's support of ethical principles unifies its nursing practices and settings. Registered nurses are trusted with a range of responsibilities in various roles in clinical practice education, leadership, or research. The nurse may be required to make decisions beneficial to the patient, nursing student, employee, or organization. If a nursing action requires a patient's preference or conflicts with ethical principles, the registered nurse may be acting unethically. Emphasizing ethical principles in nursing will increase decision-making confidence across any nursing practice. Performing nursing care according to the Code of Ethics may require the registered nurse to risk adverse personal outcomes such as employer or peer backlash, but it ensures that the focus remains on the patient. Registered nurses are faced with difficult decisions each day that may affect the lives of others. A foundation based in ethics helps ensure those decisions are the best route forward. Trust in the nursing profession by individuals and society isn't to be taken lightly. Increasing ethical awareness in nursing can help ensure that the nursing profession maintains that trust, supports nursing colleagues, and continues to develop the future of nursing. Why ethics in nursing matters, no date. This plan is patient-centered and uniquely serves Mr. VR. There's a reason why nurses are always considered the most trusted profession, and we need to keep it that way. I first believed that VR would understand the importance of the lifestyle adjustments needed to improve his overall health outcomes when I prepared this health intervention. I was aware that he was cognitively capable of comprehending the justification for the permitted adjustments and that he was prepared to accept support in making informed decisions about his healthcare plan. After receiving evidence-based instructional resources and methods, VR was able to communicate clearly the dangers of disregarding diabetes treatment recommendations and the advantages of adopting the suggested lifestyle changes. VR created a list of inquiries he wanted to pose to members of the interprofessional team after examining the training materials made available to him. As a result, the expected outcome was consistent with my initial prediction. After finishing the Capstone project, I could comprehend the procedures involved in creating and putting into practice practical health interventions for patients. I've come to appreciate the need to use nursing practices and evidence-based research to give my patients accurate and dependable information. To increase compliance and the effectiveness of a patient-centered care plan, I have also recognized the need to integrate technology and community services. I am sure Mr. VR will benefit from my intervention, and I am eager to see how his quality of life changes. Thanks to the RN to the BSN program, I was equipped to practice nursing specialties that I was previously unacquainted with. Finding trustworthy and helpful sources is a skill I have mastered. I have a solid understanding of designing and carrying out a successful, comprehensive health plan. I understand the need to work with a multidisciplinary team to provide top-notch care and improve patient safety. I also learned how to make educational PowerPoints and video presentations, which will be helpful throughout my work. As a leader at my hospital right now, I understand how crucial continuous education is to becoming the most excellent leader I can be. I'm eager to finish my master's program at Capella University. I want to thank all the fantastic instructors at Capella who have supported me throughout this journey.